Thank you, Leon, for that introduction. I am so honored to have you supporting tonight's event. I appreciate the opportunity to be here with all of you to celebrate Unity Healthcare this evening. For those of you that I have not yet had the pleasure of meeting, my name is Dr. Jessica Henderson Boyd, and I am proud to serve as the president and CEO of this amazing organization. For those of you that do know me, you know that I do some of my best thinking while out hiking with Charlie. And one recent morning, I was inspired listening to Jill Scott's A Long Walk, the song that was playing when I walked on stage. Jill Scott has said that that song was inspired by a moment of pure joy. She was feeling a sense of community, belonging, and connection. She's singing with optimism about the ups and downs of life and moving forward, even when things are tough. I was moved. This is what we do at Unity. We bring a sense of community, belonging, and connection to people's everyday lives. And even when things are tough, we keep moving forward. So humor me, and with that in mind, let's take a long walk around Unity so I can share with you more about what the place, the people, and the promise of the organization look like to me. So let's start with the place. One might say that Unity is actually 27 places, and that number keeps growing, because as we have done since our founding, more than 35 years ago, we continue to grow where the need is greatest. Over the last year alone, we began providing services at the new LGBTQ+ homeless shelter and to migrants arriving right here at Union Station. And we have supported the expansion of medical respite services to those experiencing homelessness and facing serious illness in the district. Unity is about community, and that means meeting people wherever they are to provide that care. That looks like providing care in the neighborhoods where our patients live, in schools, in homeless shelters, on the streets, or in the jail. But Unity as a place is about more than bricks and mortar. It is also about belonging and creating and maintaining a space of dignity and respect, which is critical in a world where our patients may not always be treated that way. And it's also about connection. At Unity, we strive to be holistic. We provide comprehensive services that take into account a person's unique lived experiences. It means having social services, dental care, behavioral health, and substance use disorder treatment all integrated right into primary care. But it also means having specialty care like podiatry, eye care, and weight management readily available. And I could go on. Unity is sometimes like being everything, everywhere, all at once. Now I want to talk about the people who are on this walk with us, the patients we serve, the staff who do this incredibly important work, many of who are in the room today, and the partners who support us to reach our goals, like all of you here tonight. Now, many of you know I'm a data geek, so I'm going to start with the numbers. And you heard Leon say earlier that we serve nearly 90,000 patients each year. That is 1 in 8 DC residents. We care for more than 10,000 seniors and more than 20,000 babies and children in the city. 90% of our patients are people of color, and about 70% live below the federal poverty line. Our patients are people who are part of all of our lives. They are chefs, they are teachers, they are Uber drivers, community activists, historians, and even the barista across from our office. I recently met a fellow health center CEO, and she shared with me that she was a Unity patient. She said when she graduated from school, she didn't have insurance, but she knew that Unity would be a place that she could get good health care. And when I think about our patients, I think about my patient, William. He's a 21-year-old who's been struggling to manage his asthma. William immigrated from El Salvador when he was 12 years old. Like many of our patients, he didn't have a stable medical home. William visited the emergency room 10 times for his asthma in 1 year. He was hospitalized 3 of those times, and once he was so severe that he told me that he remembers it as being in a coma. Finally, someone in the emergency room said, "You know, you could go to Unity for care." And he ended up walking into our Upper Cardozo location one day when he was having an episode and was treated for his asthma that day. And they referred him to a specialist within Unity, me. And in my first conversation with him, I asked him what he hoped to accomplish, and he said, "I just want to be able to work." The ER saved William's life multiple times, but it didn't actually make him better. Here at Unity, we were able to help stabilize his asthma, we set him up with insurance, and he was able to keep working and support his brand new family. So William's story, it highlights the strengths of our staff and our team-based approach. There are nearly 1,000 of us, physicians, nurse practitioners, care coordinators, social workers, nurses, medical assistants, and more, all playing critical roles to help improve the lives of our patients, each with their own unique story like William. And we have amazing partners and donors, many of whom are in the room tonight, that also want to improve the healthcare ecosystem and help ensure we have the financing and resources necessary to continue to meet our mission. And finally, I want to talk about the promise of the organization. To me, this starts with our purpose and our reason for existing. At Unity, our mission is to reach people wherever they are, to provide compassionate, comprehensive, high-quality healthcare that is accessible to all and advances health equity in Washington, D.C. We still have a ways to reach our ultimate goal. The difference in the average life expectancy between Ward 3 residents, and you can think of neighborhoods like Chevy Chase and Cleveland Park, and in Ward 8, which includes neighborhoods such as Anacostia, where I practice, it's not 2 years, it's not 5 years, it's not even a decade, it's 16 years. I have a niece who is 16 years old, and that is her entire life. Think about what an extra 16 years would mean to you and to your family. It might mean economic and educational stability. It might mean being there to guide generations to come. Think about the life moments that happen in 16 years. Seeing a child graduate, get married, or even have their dream job, a grandchild born, or creating new memories with old friends. Many district residents don't get this chance. They simply die too young. If you live in Ward 8, you are 2.5 times more likely to die from cancer. You are 4 times more likely to die from heart disease. You are 6 times more likely to die from diabetes. And for a Black mother in DC, the maternal mortality rate is 10 times higher than the national average. I hope this takes your breath away. While sobering, this reality provides our roadmap to achieve health equity. Simply put, we are taking on the life expectancy gap in the district, and we are going to make a difference in the clinical outcomes of our patients and the quality of their lives. Because of our scale, our ability to be everything, everywhere, all at once, I know this is possible. In A Long Walk, Jill Scott sings, "I'm hoping you can find the time. Your heart and mine align." I think that's one of Unity's most special attributes. We work really hard to align with our patients and walk alongside them in their health journey. We are quite literally a safety net for so many in the district, and I'm asking you tonight to help us further secure that net. It's people like you who make the difference in our ability to reach so many patients in these critical ways. I am grateful for this place, for our people, and the promise of what is possible. I firmly believe we can accomplish so much more when we come together. Thank you again for being here tonight and for your generosity and support of this work. Thank you.